Hello, everyone. This is Sydney, and today we'll be discussing Parkinson's disease and reviewing a case study of a fictional patient, Rita McCormick. So, a little bit about the pathophysiology. Parkinson's disease, also called PD, is the official name to describe symptoms such as bradykinesia with rigidity and or tremors in patients. And although the cause of Parkinson's is unknown, we do know that patients lose the cells that produce dopamine in the substantia nigra portion of the brain. And the loss of these cells is very slow and progressive, and it results in a neurotransmitter imbalance. Okay, so patients with PD typically have trouble chewing and swallowing due to the weakening of muscles. This can be a major concern because 60% of PD patients are at risk of malnutrition. Some nutritional implications that can lead to malnutrition of PD patients are drug nutrient interactions, weight loss, inadequate intake, inadequate protein intake, dehydration, decrease in activities of daily life, including the ability to feed yourself, consumption and motility dysfunction, which includes chewing, swallowing, and constipation. Some nutritional diagnoses used to diagnose PD patients include inadequate or excessive energy intake, inadequate or excessive oral intake, increased nutrient needs, evident protein energy malnutrition, inadequate vitamin or mineral intake, food medication interactions, and so much more. So, due to the weakening of muscles and other gastrointestinal complications that goes on, GERD is another common concern for those with Parkinson's disease. Sometimes they may be placed on enteral feeding or have a peg tube placement because of the weakening of muscles and the inadequate oral energy intake. So, two medications that are used to treat Parkinson's are levodopa and pyridoxine, and they are the two most common medications with food drug interactions in patients with PD. And we'll get into it a little more later on in the presentation. So, for our fictional case study, our patient Rita McCormick, these were her labs, the abnormal labs at least. So the first abnormal lab is her GFR rate, which was low, and a low value usually suggests abnormal kidney function. The nutritional implications: you should follow a low salt diet and a low fat diet, exercise, and just try to maintain a healthy weight. Her osmolality was high, and this can be an indicator of dehydration, and it's recommended that you drink more liquids, specifically liquids containing electrolytes such as Powerade, Body Armor, and Gatorade. Her protein overall was low, and a low protein can be an indicator of liver and kidney disorders and malnutrition. So it's just recommended that you increase your protein intake in the diet with high sources of protein like liver, kidney beans, meat, poultry, and things like that. So her albumin and prealbumin were also low. This can mean anything from inflammation, shock, Crohn's disease, malnutrition, trauma, liver disease, infection. And for both of these lab values, it's recommended that you eat more high protein foods and avoid alcohol consumption. Okay. So her white blood cell count was high, and this is typically an indicator of infection somewhere in the body. And all you can really do for this is just try and eat a healthful diet with a variety of foods, including high protein foods, to help with the healing process. So her red blood cell count was low, and red blood cell A low red blood cell count is typically indicated by aplastic anemia, cancer, kidney disease, iron deficiency anemia, vitamin deficiency anemia, certain medications, cirrhosis, and there's a whole lot of other factors that can cause this. So it's recommended that you just intake high iron foods and vitamins and minerals like B12 and folate to help maintain healthy red blood cell levels. Her hemoglobin and her hematocrit was low, so it's just recommended that you eat foods rich in iron and folate and increase the consumption of red meats, especially liver, if you have low hemoglobin and hematocrit levels. So, her transferrin was high, and this just measures your ability to transport iron in the blood. So, a high level may mean that you have iron deficiency anemia or inflammation somewhere in the body. It's recommended that you increase the amount of iron in your diet by eating more leafy green vegetables, more red meats, and increase your vitamin C intake to help with the absorption of iron. Her ferritin was low, and this could mean that she has inflammation, hyperthyroidism, CKD, liver disease, and all that you can do is increase your leafy green vegetables and meat and poultry intake. Her total iron binding capacity was high, and this can mean that there is a iron deficiency anemia, hemochromatosis, iron or lead poisoning, malnutrition, inflammation, iron overload, etc. So it's recommended you monitor your foods with iron and make sure that you're just consuming levels that are adequate for you. Okay, so drug nutrient interactions. These are the 4 medications that Rita McCormick was prescribed. The first one being Sinemet, and this is levodopa, like we talked about before, and is used to treat the symptoms of PD. Foods with high fat, high protein, and fiber content should be avoided at the time that you're taking the medication. So you can take it 30 minutes before you eat or an hour after eating. So esomeprazole is used to treat GERD, and there aren't really any known food-drug interactions with this medication. She's also on omega-3 fatty acids to help lower her triglycerides and raise HDL good cholesterol. And also with this one, there aren't any known food-drug interactions. But you should be cautious and just ask your doctor if you can take this medication if you know that you have a peanut or a soy allergy, because those ingredients are used in this medication supplement. So citalopram is used to treat depression, and consumption of caffeine products, high caffeine products like coffee, chocolate, and desserts, tea, just anything like that can cause dangerous side effects, so you should avoid those at all costs. And you can take this medication on a full or empty stomach. Okay, so let's get into some patient history. Rita McCormick is a 69-year-old female who was admitted into the hospital with fever, cough, and respiratory symptoms, and she was to be tested to rule out pneumonia as the cause of her symptoms. She was diagnosed with Parkinson's around 10 years ago, and she's been experiencing choking, coughing, and difficulty eating for at least 6 months now. And she describes it as every time I eat, something gets stuck in my throat, I cough, and I feel like I'm choking. It just scares me to eat. So due to this difficulty, she's been on a solely liquid diet. So she's had some weight loss, which we'll get into in the next few slides. Her mother had Alzheimer's disease and her father had CAD, and she's widowed and lives with her son and his wife, who are her primary caretakers and are the ones who cook meals for her. So, a little bit about the nutrition care process. The assessment. We know that she has an increased difficulty of eating and swallowing. She had a food recall for before she was on the liquid diet, and you can see just the different things she ate. It still wasn't a lot. So this might be when she started experiencing her difficulty with chewing and swallowing. Her biochemical data, she had a fever. Her pulse was at 80. Her respiration rate was abnormal. And like I said before, her usual body weight was 110 pounds, which was around 6 months ago. But since she's been on a liquid diet, her weight decreased 18% to 90 pounds. So that's a 20-pound weight loss in 6 months. These are just some medical tests that she had done at the hospital and previous procedures. Her anthropometric measurements. So her BMI is a 17.6. So she's underweight. She's 5 feet tall, and like I said, weighs 90 pounds now. And for her nutrition focused physical exam, her hair was dull, her skin was dry, she had sunken in cheeks, evidence of temporal wasting. Her eyelids were fissured, reduced subcutaneous fat within her orbital area, and her throat was slightly dry. And she had stomatitis and chelosis noted on her lips. So these are all indicators of malnutrition, especially the muscle wasting. So let's get into her diagnosis. So for the PES statements, I put self-feeding difficulty related to Parkinson's disease as evidenced by decreased swallowing ability, liquid diet, and 18% weight loss in 6 months. For a second PES statement for her malnutrition, I put mild chronic disease or condition related malnutrition related to progressive Parkinson's disease as evidenced by weight loss of 20 pounds in 6 months, difficulty swallowing foods, muscle wasting, and BMI of 17.6. For her intervention, I just think it'd be beneficial if she had extended meal times on a soft mechanical diet, just to encourage increased oral intake before we recommend an enteral feeding tube be placed to help with supplemental nutrition. So we'll see if that works for her. And also, I want to increase the calories that she consumes and the protein intake while she's on the soft mechanical diet, as tolerated, of course, in order to try and increase her energy consumption and get her to gain some of that weight that she lost back. Okay, so monitoring and evaluation. 3 months from now, I'd like to see her back to monitor to see if her muscle wasting has improved and if she's gained any weight, to reevaluate all of her labs at her next visit to see if they've improved, and also do a food recall to see what she's eating and to examine her nutrient intake just to see if she's eating enough calories throughout the day. And also, if none of this improves, I'd like to recommend supplemental enteral feeding just to help her get more of her nutritional status back because she's underweight and very frail. Okay, so this is the nutrition care manual. These are just different tips and tricks, diets that you can look at to just see what kind of diets are recommended for people with like Parkinson's, dysphagia, malnutrition, and things like that. And this is my bibliography with the sources I use. And thank you all for listening to my presentation. And this concludes it.